Good afternoon, everyone. Welcome. Welcome to the Public Safety Solutions for Substance Use Disorders ECHO. We're very happy to see the participation and enthusiasm of our learners and your support to this public safety ECHO sessions. My name is Andrea Havler, and I will be your facilitator for the next hour. Couple of quick reminders before we start with the didactics. This session is being recorded for later distribution. However, the information that you see on the chat will not be shared during the recording. So please feel free to add to the chat your names, email addresses, organizations, etc. Because like I said, that information will remain private. We would like to ask you please to go to the bottom part of your screens and click that mute button. We want to make sure that our speakers can present without any interruption or background noises. You will see a post-session survey link that will be dropping in the chat right now. These sessions are made for you, the learners. So it is very important for us to hear from you, to hear your needs, your wants, your preferences, or maybe even topics that you would like to see discussed in this forum. So it only takes 3 minutes. And by the way, when you complete the survey, you may qualify for a $30 gift card. We just had a winner of a gift card yesterday, and the person is here in this session, by the way, so congratulations. Like always, the spirit of ECHO is all teach, all learn. So we want your participation. We encourage a healthy conversation. We want to hear your perspectives, your views, your opinions. At the same time, we kindly ask you to please try to keep your comments brief, just in the interest of time, because we only have 1 session, 1 hour for the session, I'm sorry. So let's be brief so others can have the same opportunity and participate. And with that, let's go with introductions, because this is going to be a very rich conversation. And I know the hour is going to fly as usually. So we start introducing our Public Safety Hub members, and we're going to start with someone who we haven't seen in a long time. And it's a very special part of this Public Safety Hub. Joe Ismaro, could you introduce yourself to our audience, please?
Yeah, thank you. My name is Joe Smaro, former San Antonio police officer. I worked on the mental health unit there for the last 11 years. I was with the San Antonio Police Department 15 years. Voluntarily left in 2020 to pursue what was my side hustle and now is a full-blown, growing, thriving business, and which is Solution Point Plus. And we basically operate at the intersection of criminal justice and behavioral health systems and where those intersect. And I'm just super excited to be here. Finally, my schedule allowed. Thank you.
And so are we to see you here. Welcome to our sessions. Dr. Miramontes, could you introduce yourself, please?
Good morning. I'm Dr. Dave Miramontes. I'm the medical director for the San Antonio Fire Department. I'm an associate clinical professor at UT Health. And I do a lot of work in this space with buprenorphine and Narcan interactions with the fire department.
Thank you, Dr. Miramontes. Jeremiah.
Hi, everybody. I'm Jeremiah Golka, Executive Director of the SHIELD Training Initiative. We do occupational health and safety trainings for law enforcement and criminal justice professionals in their response to the overdose crisis and other addiction-related issues, including helping build linkages with community services, treatment, and so on. Always happy to be here.
All right, thank you. And with that, we're going to start with our didactics. As you know, we discussed this topic, the first part of this topic last November. One of our hub members, Cynthia Mendiola, started the conversation about strategies for communication for persons in recovery in the judicial setting. But today, very special speaker, Diane Thomas, she very graciously volunteered to present the second part. I do remember how interesting it was at the time, but this second part, I think it's a little bit more in depth. We're going to discuss a little bit more the motivational interviewing aspects of the communication strategies. So I will recommend for all of you to take notes, because there is a lot of valuable information in this didactics. Diane Thomas, could you introduce yourself and take it away with your didactics?
Thank you so much. So my name is Diane Thomas. I am, as of the last 2 weeks, currently employed as a Bell County clinician, a juvenile clinician for substance abuse. I am a retired federal probation officer from the Western District of Texas. So I have about 27 years experience with working with clients. I'm going to go ahead and share my screen and get started. So as Ms. Hebler stated, I am filling in for Cindy Mendiola, and she is the expert in this. So this is going to be part 2 of the of what was taught back in November. Can you guys see the screen clearly?
Yes, we can.
Okay, great. So this is going to be part 2 of effective communication in community corrections. Let's get started here. Hold on one second.
Diane, let us know if you need any help moving your slides.
Okay. I'm probably going to need some help because for some reason.
Sure, no problem. Carly, could we help Diane move her slides?
Here we go.
Okay, so as you want to go along, you just tell us, Diane, next slide, and Carly will move it for you, okay?
Okay, great. So I guess the disclosures, all speakers and all members of the planning committee have no relevant financial relationship with a commercial interest to disclose. You can move the slide. So the objectives today is going to be, we're going to review and give you a refresher of some strategies of the motivational interviewing used in bridging the skills of effective use of disapproval and effective use of reinforcement. And we're going to learn about the stages of change that correspond to using these 2 bridging skills. And we're also going to learn the strategy used when probation officers use the bridging skills of effective use of disapproval and effective use of reinforcement. So there'll be some refresher and some slides that you guys have previously seen. You can go ahead and move the slides. So the refresher for motivational interviewing, if you can click, Cindy Mendiola had talked to you guys about the MI strategies, the ask open-ended questions. Those are so important to gaining information. You have listening, reflective, active listening. So you need to be able to reflect what the client is saying. And what I like about this part, this is like so important, is that you have to be able to, what we say, kind of speak their language and whatever their desired outcome is. So you have to gain as much information as you can using the motivational interview strategies. And you have to give them affirmations and make sure and give them clarity that you understand what they're saying. And try to pull out the carrots. You're going to find the carrots and you're going to put them in the basket. So those are going to be some self-motivational statements that you hear them make. Those are going to be your carrots and you're going to bring them out later. And then you're going to summarize everything that you heard them say. And I'll just use a plain example. I want to be able to support my family. I want to be financially stable. All of those positive motivational statements, like you want to use those as your carrots later during their supervision period. You can move the slide. And so for lasting change to occur, there needs to be a level of intrinsic motivation. So when you have those carrots in your basket, it's their language, it's their words. You're going to use that back with them. And that's how they're going to intrinsically want to motivate to change, because it's their language. You're speaking their language, okay? And they're going to recognize and it's going to have some internal impact on it when you bring those carrots back out. And this is how we increase their motivation to change. The probability that change will occur is influenced by interpersonal interaction. You want to increase the awareness of what happens through your conversations, with others. People change when they are given the opportunity to talk and to think. They have to talk, they have to think. It's their ideas, it's their plan. Even though, you may not agree with a lot of the things that they say, you try to motivate them in the right directions to lead them to good outcomes. The more a person verbalizes, the more you give them the opportunity to talk, the more carrots you're going to get from them. So use active listening. You can go ahead and move the slide. All right, so this is a refresher. So in a relationship as a probation officer, I probably already did the relationship skills. I built the relationship using active listening. I gave some feedback and I did role clarification. I got a lot of information before I start going into these bridging skills. And the two bridging skills we're going to go over today is effective use of reinforcement and effective use of disapproval. You can actually bridge those two skills together in one setting. And that's how we're going to increase the motivation to stop certain behaviors. You can go ahead and move the slide. So in using those carrots and listening to the statements that the client is giving you, you're going to see where they're at. Are they in pre-contemplation or are they in contemplation? The goal is to move them from pre-contemplation to contemplation, to maintenance, to action. And the only way you can do that is to increase their awareness by bridging the skills. When you hear the behavior or you see the behavior, you have to address it by using these two bridging skills, which is going to be reinforcement and disapproval. You can move the slide. Let's start off with effective use of reinforcement. This is going to be, it has several steps in it, and you can move the slide. Let's look at the steps that they have. The goal of effective use of reinforcement and effective use of disapproval, the whole goal of those two skills are going to get the client to talk, okay? You want them to talk about, you know, why is it gonna be important for you to change? And what's gonna be the benefit of you to change? Let's see, move to the next slide. You're going to see, a person is self-centered method of fostering the change by allowing other person to talk. You're going to see them, the more you allow them to talk, you're going to hear statements of why they should change. So you want to have a conversation to raise awareness of pros associated with pro-social decisions or behavior. You can move the slide. So this is so important right here. There's 4 steps in effective reinforcement. You have to identify the pro-social behavior that you like to reinforce. For instance, if they were honest, you always want them to be honest. So you want to reinforce honesty, okay? If they got a new job, well, you probably don't always want them to get a new job, but what did they actually do to get the new job? I had to work hard to obtain that job. You want to reinforce working hard. So you just pick one behavior. Okay, and that's what you want to reinforce, but you don't want to reinforce them continuously getting new jobs. We want them to maintain employment. So we want to pick out behaviors that we want to reinforce. Step 2, tell the person why you like what they said or done. Tell them why you like that they worked hard to get the job or they worked hard to get the promotion that they received. Then you bring out those carrots. Because you worked hard to get that promotion, now you're going to be able to be financially stable, like you stated in your goal earlier, because remember, we had already got a lot of information from them. So you bring back their same language that they already have given you. Ask the person, what are the short-term and the long-term benefits of continuing to engage in the behavior or the skill? Now, I like to hang out in this area here because this is an area where they get to talk a lot. I want to know the short-term benefits of you continuing to work hard that led you to that promotion. What else can you do? What else did it do for you? And then I want to hear what the long-term effects. So I hang out on step number 3 for quite some time because I am gaining more carrots. Number 4, contract with that person to use the behavior or the skill learned in the future. So it sounds like you working hard and showing up to work on time really showed your employer that you take your job seriously. And so you want them to always remember that. And so that'll be behavior that will be reinforced. So this is how they can intrinsically be able to change because they hear you making the same statements and they hear the behavior repeatedly. I repeat the behavior numerous times. working hard, working hard. All right, you can move to the next slide. So this is basically, it says, identify the pro-social behavior you like to reinforce. Let's say I want to reinforce, we'll use on substance abuse. They were honest about using marijuana. I like that they were honest about using marijuana because it shows accountability. So I want to identify the behavior. The behavior is going to be being honest. Okay, and I'm going to repeat being honest several times in my conversation with them because I want them to intrinsically be able to understand that being honest is going to lead them to a better outcome. You can change the slide. Step 2 is tell the person under supervision you like what was said or done. I like that you was honest because it shows that you're taking accountability for your behavior. So you tell them why you like them being honest. Now, not saying that you like the fact that they smoke marijuana, you like that they were honest. So you have to focus on picking that one behavior. You can move the slide. What is the purpose of step 3? Ask the person the short-term and the long-term benefits of continuing to perform or engage in that particular behavior. So if the behavior is honesty, I'm going to bring it back up to them again, and I'm going to ask them, what is the short-term benefits of you being honest right now? How does it feel that you were honest with me right now? I'm still focused on that same behavior that I want to reinforce, honesty. And then I want to ask them, if you continue to be honest about anything or any situation in life, how do you think long-term that's going to benefit you? Honest is what the behavior I'm reinforcing. Okay, you can continue to move the slide. What is the purpose of step 4? So I'm going to contract with the defendant to use the skill again in the future. I want to know that you're going to, I'm going to summarize everything that they said, and then that I'm going to ask them to commit to all the good things that they said that happened when they were honest, and to use honesty again in the future. So you want them to be able to identify, the fact that I was honest with you. At least I'm not nervous about having this conversation. I feel like I don't have to hide anything. You want to repeat and summarize all the good things about that particular behavior that you're reinforcing. Again, the behavior in my scenario I reinforced was honesty. You can move the slide. Now, let's go into effective use of disapproval. So this actually has 6 steps. And remember, when we say bridging, we're actually bridging 2 skills. So I'm doing effective use of reinforcement, and now I'm going into effective use of disapproval. The example that I use is going to be the person used marijuana. So now we have to disapprove it. Even though we just reinforced honesty, we're bridging to the disapproval of the behavior. And let's see, we got to identify the behavior that we want to disapprove. So I want to know, why did you smoke marijuana? Let's say they said, I smoked marijuana to celebrate my promotion on the job. So I'm going to tie those 2 together, and I'm going to clearly state it. Smoking marijuana to celebrate your promotion on your job is unacceptable behavior. I want them to see that marijuana and celebration is not what they need to do, because every time they celebrate, they connect those 2 together. And I want them to disconnect that. I want them to have a pro-social way to celebrate and not have marijuana connected to celebration. So I do, why didn't you like their behavior? And I tell them why I didn't like their behavior, and I'm going to pull out some more carrots that they had already gave me. They said they wanted financial stability. They said they worked really hard to obtain that particular position. They said that they was working on their recovery. I'm going to pull out all carrots that I had already collected from them. Okay. I'm also going to, bring up the fact that it is a violation, but I'm really not going to really focus too much on that because they know it's a violation. I want to focus on their language and the carrots that I had already collected. So step number 2, immediately tell the defendant in an objective manner that you disapprove of what was said or done. So it's objective. There's no feelings, there's no emotions to it. You're very objective and why you're disapproving that. Identify specific reasons why what was said or done is unacceptable. Ask the defendant to explore the short and the long-term consequences of continuing to engage in that behavior. Again, anytime we get to the short and the long-term consequences, I hang out because I'm getting more carrots. So why, tell me, if you continue to smoke marijuana to celebrate, what is the short-term consequences? How do you feel right now? Well, I don't feel great right now. Okay, so it's not a good feeling when you have to report to me and tell me that you're hot for marijuana for celebrating your promotion. So, you know, you kind of continue to repeat these, the events and the behaviors. And then what's long-term, if you continue to smoke marijuana to celebrate, even while you're under supervision, what do you think the outcome is going to be? How's that going to impact you long-term? So you hang out there, you let them talk, And then you ask the defendant to identify and discuss a pro-social alternative that could be used in place of the unacceptable behavior. Now, you got your promotion. Okay, what could you have done to celebrate that promotion? They say I could have went out to eat, could have bought my favorite steak, I could have took my family out. Those are pro-social behaviors. And that's what you want them to be able to get to, the pro-social. And then you contract with the defendant to use the pro-social alternative in the future. So the next time if you have to celebrate anything, you're going to take your family out to eat, you're going to buy your favorite steak, whatever they say, you give it right back to them in the pro-social manner. You can go to the next slide. So what behaviors do I want to motivate the person to stop? I want them to stop smoking marijuana to celebrate. Why are these important to me? Because they're going to celebrate a lot in their life, and those two don't need to be together. If I'm going to reduce this person's risk to reoffend, what behaviors would interfere with that? So then you're talking about tying it to the criminogenic needs, low self-control, anti-social personality disorders. So the criminogenic needs, you have to try to tie those in. These steps provide clarification and directions to the conversation. Clearly communicate where the court stands on these behaviors, and let the person know why we want to engage in this discussion. You have to talk about it, and you have to talk about it and let them talk about it. And you need to try to grab the carrots as they talk. Now, probation officers, we tend to have our own agenda, and we wish that they would just follow what we say, but that has not been effective in supervision. You can go to the next slide. So you have to ask the person under supervision to explore the short and the long-term goals of continuing to engage in the behavior, as I already discussed. This is for you to pull your carrots. You got to pull carrots out of what they're saying on how it's going to benefit them. Even though we already know how to benefit them, they need to be able to verbally state it. You can go to the next slide. So step number 4, engage in discussion to examine any past problems associated with the behavior. You're constantly raising awareness, and you're going to explore the future anticipated problems that may occur, because you may have the same deal occur, and what type of behavior you're going to put with it. You can move to the next slide. What is the purpose of step number 5? Ask the person to identify and discuss the pro-social alternatives that could be used in place of the unacceptable behavior. Let them come up with it. That is the whole key. You have to learn how to use their language with them. And the only way we can use the same language is getting those carrots and then giving it back to them, because that's how it intrinsically motivates them. It allows the person to make specific plans on how he or she will avoid or prevent this problematic behavior in the future. You can go to the next slide. Step number 5, engage in a discussion to identify any high-risk influences that contributed to the behavior. For instance, I was hanging out with some friends. We thought we were going to celebrate. Let's talk about that. Again, you're getting those carrots that you need. Remember the purpose of this step and make it meaningful. Not just a quick response, but it's for skill building. So you got to hang out and let them talk. You can move to the next slide. Number 6, contract with the person to use a pro-social behavior in the future. That's the contract when you say in the future, the next time you receive a promotion or you have to celebrate, are you going to commit to taking your family out to eat or buying the favorite steak that you like? So you repeat exactly what they gave you right back to them and ask them to commit to it. You can move to the next slide. Now we're going to listen to a recording of effective use of reinforcement.
Are we able to play the recording? Okay, thank you.
We are, but probably I need to reshare to include the audio. Yeah.
Okay.
Group. So tell me what your motivation was behind that. Like, why did you keep? So part of your probation was to attend treatment. And you are almost done with your treatment program at the Guidance Center, and you've attended every single group and you haven't missed one. I'm really proud of you for that. That's awesome. I'm glad that you've been attending and that you're almost done with groups. So tell me what your motivation was behind that, and like, why did you keep continuing to go to group?
My motivation was just taking care of myself mainly. Remember how when we started, I told you that I was going to start looking out for myself. That's the main motivation is myself, just being there. And I really wanted to participate because when the group started, it was like a different instructor, and then it switched to Mark, and that was kind of cool because Mark is a really good person. I liked him. So from that moment on, it inspired me and to be there, I wanted to be there every day. I was like, I'm not going to miss a class unless I'm sick or something big happens.
Yeah, sure.
But it wasn't on my schedule, and just knowing that people they're aware of what I'm doing, it makes me feel really good.
Good. So what do you see, when you look back at it or you think about going to group, what were the immediate benefits of going to group? What were things you felt or experienced in the moment after going to group?
The main purpose, my sobriety.
Okay, your sobriety.
It kept me focused. It kept me on task. It kept me sober, And every day I went, I learned something new every time. Whether it was about relapses or about building relationships and trusting people and family, and just the types of about my health, how bad these drugs are to me, or to people.
Cool.
And I've learned that they're bad, and I want to stay away from it. I want to stay away from mainly alcohol too, because a lot of my peers there are for alcohol, and I just seen them. I'm like, dang, it looks bad.
Yeah. So it sounds like what I hear you saying is that you kind of got some immediate insight to your sobriety and what maybe these drugs were doing to your health, and how they were making you feel, right? Yeah. And so what are some other benefits that you saw from going to group?
It's made me consistent.
Okay, give you some consistency.
Yeah, and it's made my mind, I got some mind power. and just like it helped me realize the path I was taking was wrong, you know.
Yeah.
And it's made me gain a new path
Sure.
that I'm
Give you
working
some
on.
better perspective.
Yeah.
Okay.
Yeah.
What else, like, and think about too in terms of maybe probation, like what is a benefit of going to group?
And that's good.
Yeah, like how does that affect your probation when you go to group?
I think
Thank you so much. So you guys can hear her in there. She's getting those carrots, and then she's hanging out and asking the open-ended questions to get more information. So that's all I have for you. If you can click to the next slide. There you go. I felt so rushed, sorry you guys, but I wanted to get it in my time allotted. So thank you.
Thank you so much, Diane. We know that the topic is pretty extensive to be covered in 20 minutes, but I think that we kind of had a very nice summary of some of the strategies for communication as we expected. Do we have any questions or any comments related to the didactics? Does anyone in the audience relate to any of the strategies or the steps that Diane just shared with us? Please unmute and feel free to talk. Anything that anyone, any of you related to communication in your settings that you feel or you think that could be connected to what the material we just reviewed?
I have a quick question for Diane. Diane, thank you. That was really great. I was just curious if you could say more about the effective use of disapproval. Like intuitively, it feels a little contrary to MI. So can you say how you kind of maintain that working relationship when you convey, you know, the piece that isn't approved, which I assume is, you know, violating a court order of some sort?
Yeah, so effective use of disapproval is definitely disapproving behavior that you don't want to see repeated. It's going to lead them to a bad outcome, not only under supervision, but even when they get off of supervision. So for example, you know, smoking marijuana to celebrate your promotion is going to lead you probably to be back on supervision if you don't stop the behavior even when you get off. So you just kind of show them that this type of behavior is going to continuously lead you to bad outcomes. I hope, did I answer your question, Adrian?
Yeah, I was just sort of thinking or curious about like how people respond to it, say versus like a more traditional MI approach.
Right. We've had pretty great response to it because they do most of the talking. You point out the short-term and the long-term benefits and they're talking it. If you continue to smoke marijuana to celebrate while you're under supervision, how's that going to impact your life? How's it going to impact your family? Do you like those things? No. You know, so they kind of talk themselves through it. It's just continue to use the open-ended questions.
If I could add on to that, here in Bexar County, we use MI. It's mandatory for all the officers to learn motivational interviewing. And I think when we do the disapproval, one thing we always teach our staff is to focus on the behavior and kind of reinforce the idea that you're not a bad person, you're not a failure. This particular behavior is not acceptable. And so and by doing that, because a lot of times you'll hear the probationer say like, I really am a good person. I really am a good person, because like Ms. Thomas was saying, a lot of times they haven't had in general those affirmations or have that self-worth. So when we express disapproval, we really are just like focusing on the behavior itself and then tying it back to how by stopping that behavior, it's going to help them reach that long-term goal.
Mm-hmm. Thank you, Veronica. That was good.
Thank you, Veronica. That was great. Thank you. And in the interest of time, we're going to move very quickly towards our announcements, and then we're going to start discussing our case. So, Carly, whenever you're ready with the announcements. The Center for Substance Training and Telementoring is focused on promoting best practices for testing and treating and referring people who are affected by substance use disorders. Right now we have 6 series and hopefully more to come. And of course, this program wouldn't be possible if it wasn't for the support and the receptivity that all of you have shown. So please keep coming and keep just telling other people to join us, because we're very happy to see you here and very happy with what we're seeing, that it's happening in the field of substance use here in Texas and the US. And please join us for our next session. We can move to the next slide. Yes, we're going to be talking about crisis. It's a crisis intervention training, or CIT. Nick Margiotta, detective, is going to be talking about that in our June session. So please do not miss that. It's going to be very, very rich, interesting topic. Thank you. And now we have our case presenter is Michael Watkins. He is someone who rides along with the opioid response team, part of the Dallas Fire Department. Michael, can you walk us very quickly through the case and tell us what happened here?
Yeah, hi everyone. Yeah, part of the overdose response team through Recovery Resource Council and partnered with Dallas Fire and Rescue. Essentially what we do, we follow up with clients that have had a 911 substance use or overdose call. And because of HIPAA, and we, again, partnered with the Dallas Fire Department, since they're the ones that respond to these calls. And then we go out to follow up, whether it's knocking on their door and seeing if we can get them connected with any kind of services. Whether that be just giving them Narcan in my card, helping them get connected with medication-assisted treatment, helping them get connected with inpatient or outpatient, or even peer services. And I will clarify, it says I'm LCDC, I'm actually an RSPS, working towards LCDC. But in this case, we were looking for a client that was on our list, had, experienced an overdose. And a lot of times we end up with addresses where we can't find this person. So this address took us to a parking lot, a shopping center. And while we were looking for the one client, we happened to look over and there was a gentleman hanging out of his car, unresponsive, upside down in the back seat. And immediately, since I'm with a paramedic, he's not an emergency paramedic, so he's not equipped necessarily to handle, he's engaged with the person, and they removed him out of the car, not responsive. So he immediately called 911. And once 911 was on their way out, I went ahead and, after checking in with him, I said, hey, I'm going to give him some Narcan. And he agreed. And so I did. I administered 1 dose of Narcan. And within a few minutes, he was able to respond right prior to the ambulance showing up, the fire department and the ambulance. And from what we've got here, just a brief description of the gentleman. He was in a white male, his clothes looked pretty neat. He didn't look unkempt. And then once he came to, he wasn't combative. He was willing to go with the ambulance. One thing I will say about the area itself is known for heavy drugs, heavy prostitution. And so that it's not uncommon for that to happen in that area. It just happened to be one of those where we were at the right place at the right time. And Carly, could you scroll down, please? Thank you. So again, with operating procedure, this was a new one for me. Usually, like I said, we respond 24 to 72 hours after the fact. And it was happening right in front of us. Thankfully, and I'll be honest, this was the first time I've ever had to administer Narcan. I've done plenty of Narcan trainings and, to different agencies and different facilities. And thankfully, immediately there wasn't any hesitation and we were able to help this guy. Part of the barriers, we never found out what exactly was in his system, because once they took him, I didn't have a chance, obviously, to speak with him, but he does fall into that category where we go back and try to find these clients, these people that have had this experience. And once we found him in the narrative, unfortunately, the address that they had listed for him was the exact location where we found him. So our next step is really to just go back to that area. But those are one of the boundaries that we face, is not necessarily knowing where these people are. At the same time, there was someone in the car with him. We were able to give her our information, some more Narcan, with the hopes that maybe they will reach out if we're not able to find him. And could you continue to go, please? Scroll. So barriers, barriers, I faced, obviously, were being able to follow up with this person and knowing exactly what he had taken. Obviously, with Narcan being effective, there was some form of opioid or opiate in his system. And, what barriers he might face, it seems whether it was a one-time thing or a substance use disorder could be apparent, especially if he's in that area. But again, that's just speculation at this point. And again, what went well, right place at the right time. We're able to administer Narcan right away. And thankfully he came to after one dose and we didn't have to administer anymore. And the question is, what would I have done differently in this scenario? And that's where I'm open to feedback. I think the one things I know I could have, at least with the paramedics that arrived, spoken with one of them and said, hey, could you please get some solid information, or try to get some information for this gentleman so that you can share with our team. Our team, we've been riding with Dallas since January, so there's still a lot of paramedics that aren't familiar with our program yet. We've been doing this a year and a half now in Tarrant County, but people are still, especially even within the fire department, sometimes in other stations, they're not realizing that this team's in place, even with the police department as well. What do you think success might look like in this case? Immediate success was he was able to be taken to the hospital long-term. I would hope that we could get in touch with him and we could help him get some kind of help. And even if we can't get in touch with him and help him, that he's able to get some kind of help through the hospital system. We referred him out. Again, we refer out for peer services, outpatient, residential, medication-assisted treatment. And so, yeah, I guess one of the questions I would have is, I'm completely open to feedback on what I could have done differently and in the future. But that's that in a nutshell, really. So I appreciate everyone listening and being able to be here.
No, thank you, Michael, for presenting the case. Kristen, do you have a question?
I do. I was going to offer some feedback, and this might be more appropriately directed at the leadership, especially Dr. Miramontes on the call. But so I'm a pharmacist by training. I work for the Houston Recovery Center. So they're involved with the Frontlines Project, which is very similar to what you're describing. And UT Health Heroes is also on the call. So they're also doing outreach. And so one of the issues that I have had, so with a brief background, I'm a former police dispatcher, EMT, and also a person in long-term recovery. And so I am very much aware that the people that have the data on EMS calls and who these patients are don't communicate to the boots on the ground, right? And so being able to collect, share that information in a way that doesn't create additional barriers for outreach is something that actually has to be initiated at the beginning of the conversations with MOUs. And so I have found that even with, especially with smaller departments, but sometimes with larger departments, they encounter barriers to providing this information. And it ends up being the dead ends that you're talking about, which can be a dead end for the patient. So Dr. Miramontes and anybody else with feedback, when we as organizations, either treatment providers or boots on the ground, coalitions that are the ones going out, doing the outreach, connecting these people with services, when we are not able, when we start those conversations to get the data on who these patients are, like how can we facilitate that in a way that benefits everybody?
Yeah, I'll jump in. So a couple things that I would recommend is first, leave your card. Put it in his pants before the ambulance takes it away. We actually put it in their wallet because usually fire or the police are going to find his wallet to get his ID and to run him. So we put our card in his wallet. So when he opens his wallet, when he's at the hospital, whoop, this card's there. Second thing, you did the right thing of giving information to the person that was with him in the car, because a lot of our referrals actually come from friends or family members. If we do outreach in an apartment complex, it's never just one referral. They show up, they see the truck, and they go, oh, those are the Narcan people. Maybe I can go over there after they're done with apartment B and I'll hook up with them, and they wait outside. So when we come out of the apartment, they're going to try and nail our providers. Hey, man, I want to get some help too. What's going on? You know, and so that's another way of doing that. Third, if you're working with Dallas Fire, they have access to the patient's records. So first of all, they have an ambulance record. Second of all, they have a hospital record. And it's covered under HIPAA because it's a continuity of operations and a continuity of care. So you need to work with your agency, Dallas Fire, and the hospitals to get that information. The other thing I would do is ride along with the patient to the hospital, or go with the ambulance to the hospital. And then you can interface with the staff of the hospital. And then you just reach over to the clerk and say, hey, can I get a face sheet for this patient? Boop, they print it. There's all the information. Now, that information probably isn't very good because it may not have an address, but at least you're a step in the right direction. And I think the big thing for you to try and motivate and to get more outreach with your folks is to go to roll call with the police departments in the morning, or figure out how you can get some FaceTime, even if it's a video, 5-minute video that they play at roll call, or a 5-minute video or FaceTime at roll call at the fire department, or whatever ways that you can do that. So I can tell you, when I'm out and about and I go to a scene, the police department goes, oh, that's the doc that's got the Narcan. Let's go talk to him. Right? They know me by face and vehicle, that I'm the guy that's doing Narcan outreach and Suboxone. So that's what you need. You need that exposure and that name recognition so that you can impact your client. It sounds like this client's not ready for recovery anyway, but having that information on the client's person and doing that outreach, I think, is important, because you may not get them this time, but you may get them next time, or the next time, or the next time. And the other trick that we do here in San Antonio is we use the homeless information system. We can use the electronic patient care record for the fire department. We can say, oh, we caught him on this corner. Oh, but he's at a house this week. Let's go see if he's at this house. So you'll be able to search by that patient's name to find out where he's at recently. So those are all some little tricks that I think that I would suggest to promote that engagement, that acceptance by your community, and that follow through. It's tough work. I can tell you that a lot of the patients in our system, we have the same 24, 48-hour follow-up thing. We don't find them on the first or second time, but we may find them on the 5th time or the 6th time, or whatever time that we have interaction with them. So hopefully that helps.
Thank you, Dr. Miramontes. Anyone else, India, from our learners or from our hub members, who would like to add anything who would like to suggest anything about, what we just discussed about the case?
I was just about to say, great job in taking care of the patient in the right way. So you saw it out, you're out doing outreach, you found a problem, and you jumped in. And you did exactly what you're supposed to. Give Narcan, open the airway, call for help. Perfect. That's exactly what we would ask from any of our police officers, anyone in the jail, anyone in the correctional institutions, to do the same thing. Open the airway, give Narcan. If they don't perk up in a minute or so, start CPR.
All right.
It looks like there are a couple comments from folks in the chat about, say, community outreach, community agencies, and how they can participate in this, because that was the question I wanted to ask generally and to this audience, and for especially folks who are among community agencies. Like, how can you all how do you all interact with folks, especially to help track down folks who are hard to track down, or to do outreach to folks who may not want to be interacting with the more official services, but want to do something with more of a community approach?
Or they want to use a peer system rather than an official cop, firefighter, hospital.
Correct. Exactly. Anyone has any ideas? We just had didactics on strategies for communication. I wonder if somehow we could connect what we just talked about, communication, and about the way we talk to these people when we found them, and in these situations that can help them to have that trust and open up and tell us where they live and all these other things. Jeremiah, what do you think?
Yeah, I mean, this is a whole, we're actually developing a whole training now at the SHIELD training initiative about boosting the co-outreach between police and community agencies, so that each side can bring their best skills to bear, recognizing that outreach is often, just trying to start a conversation, right? It's not trying to solve a problem in the moment, but try to, aside from keeping someone alive, right? That's obviously kind of a problem that you want to solve in the moment, but otherwise opening the conversation. And so, yeah, I don't know if there's anyone in the audience who wants to talk about that, or maybe, we could hear more also about if there are any existing kind of linkages between Dallas Fire and some community folks there, who maybe there'd be other folks who could have locally helped, if you have those sort of relationships existing.
Dr. Miramontes.
Yeah, I'm just going to say, this is how I approach it. Hey, my name is Dr. Dave. I'm with the fire department. I'm not a cop. Hey, I just want to see, sounds like you're having a hard time with your narcotic use. You just overdosed. Have you thought about getting treatment, or have you thought about that? And I can help you. I can get you started on Suboxone. I can refer you to a peer coach. I can get you into treatment. Is that something you're interested in, or have you thought about that before? I just put it back like, hey, I'm Dave. I'm here to help. Here's some things I can do for you. Have you thought about going into recovery? Right. And usually that's a conversation starter. And they usually go, no, man, I'm not ready. I don't want to do that right now. I got too much going on. And then you say, well, how about would it be okay if I give you your name and phone number to one of my peer coaches that may want to reach out to you? These are people that were in your shoes a couple of years ago. Maybe they have some insight that help you along this journey. And sometimes that works, sometimes it don't. And either way, we still leave the card, right? And we open up that communication. And like I said, it may take 2 or 3 times, phone calls, visits, or whatever, to try and reach this person, because they may not be ready in the moment to engage in that conversation. But getting back to them as best you can is the best option as far as I'm concerned.
Thank you, Dr. Miramontes. Jeremiah, would you like to summarize a little bit the case and some of the recommendations or alternatives that we offer today?
Sure. Gladly. Yeah, again, thank you, Mr. Watkins, for that presentation, for the what you did. Seeing this, the appropriate naloxone administration, seeing the situation, and then trying to what can you do to this challenge about how do you provide further outreach resources and services to someone who does not want to engage, who you don't know how to find them again, or or it could be someone who truly doesn't, who is unhoused and doesn't have, where it's hard to reach them. So there are these various options that have been proposed. None of it's all, I think, a kind of a silver bullet, but Dr. Miramontes mentioned that there are specific ways through the connecting with the ambulance, with the technical terms of that, Dr. Miramontes, you could, I forgot what that paperwork terminology is, but there's the paperwork you can track back down.
The form. The
the
form. What's
forms.
the name of the form, Dr. Miramontes?
So at the hospital, you get a face sheet. What that is
Cool.
it's just their demographic information from the hospital. You can also get that information from Dallas Fire's ambulance run sheet. You can get it if the police were there. You can get a copy of they were going to run that person's ID. You can just get a picture of that as well. Those are all different quick tricks for our 8 different agencies can help you to find these people.
Cool. There's they've also mentioned the possibility of giving a card or information, whether it's your own outreach or other local outreach services to the patient or the person who was with the patient. Because you mentioned there's that other person there, providing that person right then, sticking it on, into the pocket or the wallet of the patient in the hope that maybe they'll see it later. That might be the kind of thing that's possibly just a good practice to go with. And then let's see what else. And then there was the outreach services locally, and in community services. So it can, whether perhaps you have those resources on hand, just to provide that both the patient as well as the person who was with the patient to say, okay, well, we can provide outreach, but there's also community resources that can provide outreach, such as like X, Y, and Z. They're different. Of course, there are a bunch of, in different jurisdictions, there's different programs where a peer coach can be kind of provided, or at least a referral to one right away. That then also takes some of that work off of the EMS too, and the ED down the line. So there are these different little pieces in it. But it's a challenge. Folks don't always want help right away. They're not necessarily ready for it, or it's just hard to track down. So even in asking that, this is a really good case because you've got a very concrete ask, trying to solve a real problem, or that's it's like a finite problem that it helps it address bigger problems. So thank you.
Well, and we want to thank Diane Thomas. Thank you so much for presenting with us. We're very happy to have you with us today. It was great to have you as our speakers. Thank you to Michael Watkins and to all of you for participating in our Public Safety Solutions for Substance Use Disorders ECHO. Remember to complete that post-session survey so we can hear from you, and also you may qualify for a $30 gift card. Thank you to all again, and we'll see you next month for another session of the Public Safety ECHO. Thank you and have a great afternoon. Bye.